Hi, I'm Dr. Mark King from the Motion Palpation Institute in Cincinnati, Ohio in the U.S. And I'm going to talk a minute or two about chondromalacia patella, something you're going to see a lot in your office. From a diagnostic standpoint, these patients will have pain with prolonged sitting. Different positions will bother them. You get in there and grind the patella around and it's very uncomfortable and will have that rough grinding kind of feeling to it. The patient will tell you and you can feel it when you move the patella around. Quad tone will often be reduced on these patients. Patellar tilt, often they have a little lateral patellar tilt, which means they're not tracking exactly right. From a functional screen standpoint, they're often not good at squatting, not good at 6-inch step down, not good at lunges, and those often hurt when they do them. So those are good screens to do on these patients. From a joint dysfunction standpoint, think about the locomotor chain. You've got the knee, but you've got to check foot and ankle, you've got to check hip into the low back. So those are important things to check when you're evaluating this chondromalacia patella. X-rays can show some narrowing of the space behind the patella. MRI will actually put a grade on it, 1 through 4, so that gives you more detail on that if you're from an imaging standpoint. Now, from a treatment standpoint, again, I repeat, locomotor chain, check all the way up. Rehab, these people often don't know how to squat, they don't know how to lunge, and when they do, it hurts. So you have to start with some low-level stuff to start to activate their glutes, to start to get them to get some motor control, get them to have a little better control of their foot and work their way up. We like DNS, but whatever your approach is, you need to get them to be more active, more neurologically balanced from a rehab standpoint. Soft tissue around that area can often be helpful. Often these patients are inflamed. So think about this anti-inflammatory diet. Do these people get a lot of relief when they take over-the-counter NSAIDs? Because if they do, you know that they need to address their diet from an inflammation standpoint. Local stuff you can do, dry needling, cold laser, radial pressure wave, radial pulse wave, shock wave, whatever you want to call it. Those all can be helpful. Some of you are going to tape the area. But those are some treatment things that you can try. Do a really good exam and it'll help narrow what really is going to be most effective from a treatment standpoint. So that's a few ideas about chondromalacia patella. So good luck in your clinic with those patients and thank you.